Good morning, good afternoon, good evening, everyone. This is Pankaj Gupta from EthAum Partners. We are a deep tech revenue scaler and fund based out of Singapore. Thanks for joining this roundtable hosted by EthAum Partners and Belun Technology. Sleep apnea is a massive global health challenge affecting millions, yet it is often underdiagnosed and undertreated. Dental sleep specialists are uniquely positioned at the forefront of transforming care, bridging diagnostics, oral appliance therapy, and patient-centered solutions. Today, we will explore innovations enabling dental sleep specialists to transform sleep apnea care. Our distinguished panelists bring expertise from clinical practice, technology innovation, system implementation, and education. We will discuss how wearables, AI, improved workflow, and billing operational innovations are empowering dentists to deliver better outcomes, scale their practices, and integrate seamlessly without broader healthcare challenges. Now, I would request our esteemed panelists to introduce themselves. If I may start with Lydia. Lydia, please.
Hi, everyone. I'm Lydia, CEO and co-founder of Belun Technology, which has working in this field for more than 10 years, and to see how we can share light on people's sleep health and to improve the overall chronic disease management.
Thank you. Thanks a lot, Lydia. Appreciate your thoughts. And I'm sure that your experience from the entrepreneurial world is going to help a lot with this conversation today. So thanks a lot for joining. Dr. Tozzer, may I request you to go next, please?
Certainly. Chuck Tozzer. I'm a general dentist, Irvine, California. That's 18 miles south of Disneyland. Everybody knows where that is. General dentist, as I said, but I've been doing sleep apnea treatment for about 4 or 5 years now, and just am thrilled to be working with Belun.
Thank you. Thanks a lot, Dr. Tozzer. I'm glad to see that you already have some good experience working with Belun. So thanks a lot for that. Dr. Lipsey, could you please go next?
Hi, everyone. I'm Dr. Marty Lipsey. This is my 21st year in sleep,
Wow.
which started in my practice, and implementation was certainly more of a novel thing, and but we managed to learn a lot, help a lot of patients, and for the last 15 years, I've been working with dental practices around the country to help them with systems, to help them with outsourced medical insurance billing, and hopefully lead to successful implementation in many dental practices around the United States.
Thank you. Thanks a lot, Dr. Lipsey. You play a very important role in any startup's adoption journey, because without implementation, without the right insurance support, it's insanely difficult for founders to scale in complex regulatory environments. So thanks a lot, Dr. Lipsey, for joining us today. Dr. Mundy, could you please introduce yourself?
Hi, my name is Craig Mundy. I practice in Fresno, California, which is the center of the state, big agricultural area. I've been doing some sleep for probably about 20 years, but a journey like a lot of general dentists, mainly treating my own patients. And I'd say in the last 10 years have really expanded out. We're doing getting a lot of referrals from MDs now and sleep MDs in the community. And so it's becoming, I still am a practicing GP also, but that's kind of winding down.
Fantastic. Thanks a lot, Dr. Mundy. And I see a lot of books and files in your background. I'm sure that all the knowledge from those books is going to come for today's session. So
they're all comic books.
Thanks to all the panelists. Really appreciate your time today. So we will have 3 themes and 3 different segments of the conversation today. First, we will talk about the current challenges, diagnostic innovations, and then we will get into the treatment innovations and the transformation. After that, we will talk about the future outlook, how to scale, how to create a broader impact with the innovations, with the right regulatory frameworks, and so on and so forth. And as I mentioned earlier, we will try to be as interactive as possible. So let me start my first question. And because Lydia is going to add a lot of technological insights, I'll request her to take the lead on this question. So Lydia, what are the biggest barrier dental sleep specialists face in accurately diagnosing and managing OSA today? And since you have talked to so many dentists over a couple of years while building Belun, what's your experience from those conversations?
Yeah, has been an exciting field, I think, since a couple of years ago, since we met all the doctors here. Because before the advancement in medical wearables and AI, the biggest barrier for patients is they usually need to be admitted to a hospital for both the diagnosis and also the titration. And it is not only very expensive, but also creating a huge barrier for both dentists and patients. But now, with the advancement, with the development of home-sleep apnea tests, multiple night study can be realized easily and comfortably at home. But of course, when you look into different types of home-sleep apnea tests, there are still quite a number of barriers, like the comfortability, the ease of use, whether the patient, especially elderly, can complete the test successfully. This all determine whether an OSA diagnosis and management can be done successfully at home, especially for titration, right? Because for titration, usually it may take multiple nights ranging from 5 to 14 days. And how we can make sure that a wearable can be comfortable, at the same time, it will not fall off very easily, which makes the test fail. How we can facilitate patients, like I mentioned, like elderly who are 80 years old, 90 years old, who are not technology savvy at all, and no smartphone, but they can still complete the test easily without the assistance of the others, especially if they live independently. And all these are key factors contributing to the success of deployment and adoption in dental sleep medicine.
Fantastic. Thanks a lot, Lydia. Appreciate your thoughts on this. Dr. Lipsey, from your perspective, what kind of barriers dental sleep specialists have been facing with the diagnosis so far? Is there any different learning that you have had than what Lydia have had?
Well, I would say that what I find as the most common challenges are establishing a patient and practice-friendly system for screening, testing, and treating. And certainly the introduction of Belun technology, the Belun rings, have made it easier for many dentists to get their at-risk patients diagnosed, to use this technology also as treatment goes along for titration. But it really, some practices are fortunate enough to have patients referred in that are already tested and diagnosed. Many don't. And I help many practices to implement systems, especially with easy to take home technology, so that patients can get tested, and then we can introduce the appropriate treatment and move forward from there. So I think this is a great help in terms of an inexpensive way for the dental team to obtain this technology, and also to present it to the patient in a way that they can easily use it in their own home, in their own bed, so that everybody wins in the process, and we can, move forward with helping more undiagnosed and untreated patients.
Fantastic. So you mentioned that the solution also has to be patient and doctor friendly. If it is not, then it just does not work. Dr. Tozzer, you have worked with Belun, and from your perspective, how innovations like multi-night wearable testing like Belun ring and AI analysis are changing the diagnostic paradigm for dental practices? What and other than Belun ring, what are the AI analysis, AI impact that you are seeing on the diagnostic innovations?
Well, the term a game changer has been way overused, but it really has been here. And the way it has been, especially for us, we have shortened our treatment time to 4 weeks from 4 months, a dozen appointments down to 3 or 4. Now, talk about pushback from a dental office that's busy already in the front office trying to squeeze in those patients. Also, we're much more standardized. What I really like about the home testing is it's easy for the patients to use, as opposed to overnight in a hospital, which has been joked to be the best measurement of their worst night's sleep. So they sleep in their own bed, their own room, and we get data that's very good and very accurate. So what I want to do is when I send the patients back to the referring MD, I want to have data to go by. So I'm assured that I've got the best possible results I can. Previously, we kept titrating them by subjective, how they were feeling. That's all we had, and that's okay, and I still get that. But now I have some numbers to put behind it. So when I send them back, I'm assured that we have the best result possible and that I have indeed treated these patients well. And it also increases your referrals when the docs know that when they get them back from me, they get them back and they're well taken care of.
Right. So it is time reduction, 4 months to 4 weeks. It is ability to see patients more quickly, word of mouth, which is obviously always helpful, and also the accuracy of data, accuracy of information that you are dealing with. I think that's a lot of good value prop that you are able to derive out of solution like Belun. Dr. Mundy, from your perspective, what is your current process for using Belun ring in your practice, and how improved diagnostic have impacted your ability to titrate oral appliances effectively? Is your is your finding slightly different than Dr. Tozzer, or it is very much the similar? Dr. Mundy?
There's quite a lot of similarity there, really. It has been a game changer. And actually, now I get most of my patients in with sleep tests, get them from sleep doctors. So I don't use it so much for diagnostic, but for years I was in the phase of my practice where I was getting patients from my practice, and getting a diagnosis was extremely difficult. I think the biggest thing that helps the Belun ring helps with there is that you can get a diagnosis and still be in contact with the patient. In the past, you'd try to get a diagnosis and they'd end up getting stuck in the system somewhere else. You'd never see that patient again. And that made it very difficult to build a practice. But it's complicated. You need to work with doctors. And so but to me, this whole ring thing has just broken down so many barriers everywhere along the pathway. Whatever your practice looks like. One of the problems we have here is in conveying this to people is that so many people have such different situations, but yet having something that's an accurate sleep test that's cost effective to use multiple times, it just changes the game. So probably the biggest impact for me currently, I no longer get back patients from the sleep doctors that say, please titrate more. Okay. Okay. I've already done that. Okay. Number one. But they don't know that, and it's hard to convey. Now I send a summary of the results from the titrations, and they can see. Plus, it creates awareness that we're looking at a whole variety of, we're not just looking at the AHI, we're not just looking at one aspect, we're trying to make the best possible outcome for the patient.
Okay, so overall efficiency, oral coordination has improved quite significantly for the whole ecosystem. Awesome.
It's night and day difference.
Yeah. Lydia, I think you wanted to share something.
No, not really.
Oh, okay, okay. Now, so let me ask one more thing over here. From the diagnostic perspective, if you were to think about a new innovation within the diagnostic, or a new change, new capability within Belun ring, what would you recommend to Lydia and the tech team, to the research and development team? anybody can, and I know this is a surprise one, but anybody who wants to go ahead and take a stab at it.
I mean,
well, is this like a? Oh, go ahead, Marty.
No, I was just going to say that I know there's a positional device in the works that may add another component to the data that we can collect. I think that's going to add some additional insight into the patient's sleep apnea and treatment options, because I think we all, want to use anything that's applicable to help the patient. Certainly if we can evaluate position, that adds, another dimension to our analysis. But even not looking ahead, I think that with a proper screening system, from screening through testing, Dr. Tozzer, Dr. Mundy have expressed how great this is to help them with titration. And I talk to so many offices that don't have the luxury, perhaps, of having a predictable way to getting their patients tested outside the office. It can be hit and miss. It can be the patients never calling. It can be the patients getting some other treatment option because that's suggested by an outside testing service. But when we can control the process and have our at-risk patients tested, at home with the Belun ring, then I think it just opens an immense possibility of talking to them about all their treatment options, including oral appliance therapy.
Interesting. Okay, that's a pretty good insight, Dr. Lipsey, and I'm sure that Lydia and her tech team are already thinking about this in their mind on how to make this possible in the next version. Dr. Mundy, I think you wanted to share something.
Oh, I was just going to say, well, I forgot what I was going to say, but we've used the core, and that is quite helpful. Suggestion I might make is to maybe expand the reporting on that to include positional and non-positional, and tie it into REM also. She's smiling. I think they're probably already doing some things like this. And then the magic wand would be if metrics can be developed that help us as dental sleep medicine docs take care of some of the adjunctive therapies that may help our outcomes. We need help. Positional often is a huge difference. And in the past, I was totally frustrated because I know the patient was better, but on the diagnostic test on a different unit, they might have an AHI of 5, and I've gone through, 10, say 10, and I've gone through all my rigmarole, and the day they do the single post-titration test, it's a 10. Okay, well, I know they're better. And indeed, if you're doing multi-night tests, you can see they're doubling their AHI from one night to the other. And so we want to show that it matters which nights you test at, and overall there's a response to the oral appliance. I'd like to know, is this something that I should recommend instituting positional therapy or do it myself? And there's all kinds of factors that affect night-to-night variation, things like loop gain and arousal threshold and so forth. So if there can be some metric that helps to steer us in a direction that continues to increase the results, because frankly, I think with the improved adherence to oral therapy and the patient friendliness of the whole thing, if we can get doctors and ourselves to stop thinking so siloed, it's either a CPAP or it's an oral appliance and that's it. If we can think more on a bigger scale and trying to control all the factors that go on. We actually need better diagnostics, I would submit, than the MDs do. The MDs, in many senses, I'm not saying totally, but to a large extent, MDs are looking for whether they have sleep apnea or not. We're looking to find out. So we have a device that'll give us 50% improvement, more, whatever. So the details become much more important to us in becoming effective.
Interesting. And those, improvements, those enhancements are more software driven than hardware. And I'm sure that we will have a separate conversation with Lydia on that. But let me move on to the next segment of this panel, which is more around innovations and digital transformation. And I'll request Dr. Tozzer to share his opinion on, obviously, Belun ring, but what are the other emerging tools or techniques that are helping dental sleep specialists achieve higher success rate with oral appliance therapy? Dr. Tozzer, any thoughts on that?
Yeah, sure. One of our bigger frustrations is moving patients along the treatment continuum, and there's often a resistance to get started. Now, we use a screener in our dental office treating our dental patients, as Dr. Craig mentioned, but they'll say, yeah, my wife complains I snore, yeah, your screener suggests I have it, and so they're resistant. So here's where the alternate use we have for the Belun is. I tell them, hey, I can't diagnose it, but take this home. Let's see what it shows. And I have them go 2 nights, so we get a representative or 3, and they bring it in. And it's like a third vote. The screener says yes, their spouse says yes, and I'll say, hey, here's the numbers. This is what they mean. They really think you got it too. I suggest we get you officially tested. And it does move patients along the treatment continuum. Also, I got to give an attaboy to the guys over there by introducing the hypoxic burden metric. That's also, I think, a long term going to make a big difference.
Interesting. So you have not a third person, but somebody else in your bedroom voting for the spouse who is complaining.
That's it.
Which obviously makes a lot of difference because, yes, there is a lot of resistance when it comes to sleep apnea or related issues. Dr. Mundy, from your perspective, what are the other emerging tools or technologies that are helping you achieve higher success rate?
I think that I don't really have other tools per se. I think it's different implementations of the various tools we have already, and we're learning all the time on that. And like Dr. Tozzer mentioned, I think it's very important to be real flexible and just meet the patient where they're at. And the more tools you have to do that, the more successful you're going to be.
Right. Lydia, from your perspective, so obviously you have built a great product, and we can see the testimonial throughout this panel right away. But if you have to think about other emerging solutions, technologies, innovations that you can implement within Belun to achieve even higher success rate, what that would be?
Yeah, as I think Dr. Lipsey and Dr. Mundy has mentioned, indeed, we have recently soft launched the core sensor, which provide more insights and additional information like the body position, the breathing effort, and such that we can have not only multiple nights, but multiple parameters, right? Just as Dr. Tozzer has mentioned, we are not only purely relying on AHI now, but also multiple parameters like the hypoxic burden, the autonomic nervous system response, which tell you about the stress level of the patient. Especially you can compare this before treatment and during treatment. And also we have this efficiency. All this is very important. Why? Because we know that the major challenge of OSA treatment is the compliance of the patient. Okay, the compliance can be originally from the comfortability, how I can adapt to the treatment. And from multiple parameters, yes, we want the patient to get the OSA treated. But very important is that while OSA is treated, the AHI may be very, very low, pushed to maybe 0 point something, but the patient does not feel comfortable. We sometimes find that the autonomic nervous system response after the patient got different type of treatment, it may be triggered during the nights. Okay, the AHI is reduced, the OSA is treated, but the patient can't sleep. Okay, and this will overall reduce the compliance of the patient to the treatment. So what we are doing now is not only multi-nights, but also multi-parameters. And we manage the sleep holistically. It's not only on OSA, but also like the sleep efficiency, we can know that, the treatment is improving both numbers. And that will really improve the comfortability of the patient, the compliance, and which is doing good of the patient from the holistic chronic disease management point of view. And also just address what Dr. Tozzer has shared the story. We do have numerous stories like this, like a lot of people where they found that, my parents have snoring issue. I'm sleeping next to the room. I still hear my parents snoring loudly. But when we try to get them into a hospital for a test, it's very challenging. And that's why, just like what Tozzer mentioned, they just bring the ring home. And their parents are willing to wear it. And finally, the data tell them that, wow, you really have the issue. And they really treat it, and holistically, their diabetes is much better managed. And this is all the kind of successful story to tell us that different kind of emerging tools together with AI, we can probably do a better job in the holistic health management for our patients.
Fantastic. No, thanks a lot, Lydia, because in Asia, it's very difficult to tell to your parents that, hey, you snore in the night. They don't like it. But no, I do understand that you have a lot of different hardware, sensor, software, AI solutions in your product roadmap that are going to improve overall efficacy, that are going to improve overall ease of use for the patients and for doctors, which is going to make a huge difference. Thanks a lot for that. Dr. Lipsey, I mean, you have probably seen this many times. It doesn't matter how interesting your innovation is, but if it doesn't implement, it doesn't integrate in the right manner with the overall ecosystem, then it just does not work, right? From your perspective, what are the operational or billing innovations that are, enabling such solutions like Belun to scale more efficiently and make these treatments more accessible and sustainable? So what are those, side operational or billing innovations need to happen to make the real innovation successful?
So I think that ease of use is a key phrase that we can build off of. This technology, these rings hit a bullseye in the ease of use, but we also have to have ease of implementation. And certainly over the years, if we learn how to present this technology in a patient-friendly way, in an acceptable way, when we learn to speak to patients, I mean, I'm biased because I deal with insurance, but certainly everybody has the how much question. That's just human nature. And when we can help people to minimize their out-of-pocket costs, when we can help people make it easy to say yes to treatment, both with technology and with patient-friendly medical insurance systems, which have become much better in covering the all aspects of treating sleep apnea with oral appliance therapy. Certainly, if we look at 5 years ago, 10 plus years ago, it is so much easier now. We still have a ways to go. Insurance is never 100% friendly, but we can help our patients to say yes. This technology coupled with patient and practice friendly medical insurance systems, which is sometimes a challenge for the dental office because they're used to dealing with dental insurance. And when we're in the US, we're dealing with medical insurance, which most dental teams are not familiar with. So I think when we put a system together and we can be friendly in technology aspects as well as financial and insurance aspects, that then we have a winning system to help our patients from zero to understand the problem, accept the problem, and accept that they need treatment. We can really make it from zero to complete by using these different patient-friendly concepts.
Right. No, I completely agree with you on that. We work with many startups from different parts of the world, and many times we see really interesting, cool innovations that fail only because the integration was not easy enough, or only because the insurance partners were not supporting those innovations. Let me throw a surprise question to a panelist. In your career, have you been through a situation where the innovation was absolutely amazing, you just loved it, but you could not adopt it further because of the integration challenges or insurance related challenges, or because of some other operational challenges that were not supporting this real core innovation? Any example in your career?
I think that's for you, Chuck.
Well, I think the whole sleep apnea treatment with oral appliances could be that.
Okay.
There's like about 100,000 dentists that take courses, get excited, can treat patients successfully, have trouble working out systems, and then they don't get paid. And that's, Marty, where you come in, because no matter how good you're doing it, if you never get paid, they drop it. So of the 100,000 dentists that start, maybe less than 5% pursue treating these patients because they see it as a dead end. And again, it's dealing with medical insurance versus dental insurance. And they just got to realize, either learn how to do it or outsource it to someone that knows.
Yeah, I mean, it's sad to say, but it's true that I think the majority of offices get hung up and are unsuccessful because the clinical technologies, the testing, it's not so much of a challenge. Now, perhaps presenting it sometimes, the verbal skills, the team's education is just as important as the patient's education of understanding what this is about and being able to communicate how we can help the patient from testing through treatment. So from screening, testing, and treatment. But I think if we're not willing to reach out and get help to help the patient's insurance and financial concerns, we hit dead ends. And that's much easier to deal with now to help our patients. But we have to look at the totality of this, not just the actual technology and the devices that we choose, but we have to help inform patients so that we can, lead them to understanding and saying yes to treatment.
So Belun is actually also helping dentist profession becoming cool again, or at least profitable again, right? The dentist will not be losing money because of insurance reasons or some other reasons. Fantastic, thanks a lot. So now we will be moving on to the future outlook and what could be the broader impact of these different innovations. And I'll be starting with Lydia again. Lydia, from your perspective, what innovations on the horizon, AI, remote patient monitoring, or different kind of sensors will most transform dental sleep medicine in the next 3 to 5 years? A surprise element addition over here as well. If not AI, if not innovation, if you have to change something about the reimbursement policies, about the regulatory framework, what that would be that can make a huge impact in the next 3 to 5 years? Lydia, please.
Okay. Yeah, as I think all the doctors has mentioned, I think in the past few years, with more and more these home sleep test devices, indeed we have collected more data. Okay, with all this data, especially now, we are not only relying on one parameters, but multiple parameters. And all together from this, and also we will know that, certain patient, they may fail the treatment, and some of the patient, they can compound with the treatment. From all this data, it all give us insight. Okay, and it also gives us the chance to do the phenotyping, the annotyping of the patient for multiple parameters. And this is the thing that we cannot imagine maybe back in 10 years ago. But now, because with all these millions of data that we collected overnight, and it empowers us to do this. But one point very important is those data must be accurate, must be of medical grade. As mentioned, why this can be reimbursable? Because it is a FDA clear devices, not only the devices, but also the AI, and it guarantees the accuracy. And we all know if for an AI, garbage in, garbage out, right? If you don't start with very accurate data, then probably the model that we are building is not telling the truth, not telling us the truth. So it's very important is that we have high quality data, we have longitudinal data, we have multi-dimensional data. Now we are not seeing a dot, not only a line, but a plane and 3D dimensional. And with the expertise of the doctors and with all the data collected, then we can all together to see how we can help to expedite the whole treatment and titration process and also get a better results. And that's why we put a lot of effort in doing research from even proving multiple nights variability to a study and such that to ensure to people to visualize that, wow, indeed, when I getting the treatment or before the treatment, there is variability, that's normal and that's a fact. But this is not can be seen in before in the in-lab studies. And that's why I think with all this homestay pass and millions of data collected, we envision in the future, very important is evidence personalized the future treatment for our patients.
Okay, so constant improvement of AI models based on the data, accurate data that you're collecting, and obviously the accuracy, the efficacy will improve with that. Obviously you need more and more support from the experts like this sitting on the panel today. Fantastic. From Dr. Tozzer, from your perspective, other than innovation, if you had a, let's say, magic wand, what kind of change would you make in the regulatory framework or in the insurance innovation partnership framework to make it even more transformative in the next 3 to 5 years? What could be such changes in the ecosystem that you would ask for?
Oh boy, this is more on Dr. Marty's territory, but they can get reimbursement ironed out. There's every insurance is different requirements, different reporting. Now, what I do like about the ring again is they can report at 3% or 4% because some of the insurances require 1. Medicare, as you know, requires the 4%. And so the more data we have, the better off we are. But it's bridging from that data, again, to the insurance, to the reimbursement. If that could be ironed out so that flows better for the patient's benefit too. The other interesting thing I'd like to point out is patient awareness now of sleep apnea is at an all-time high. Patients come in with Apple Watches. They have some data. What I like to point out to them is that's consumer grade. What we have here is medical grade, FDA approved. So they realize that we give them more data and show them the reports. And they can look at theirs. And instead of trying to argue with you, their watch says this and you say that, it's like, oh yeah, this is FDA approved medical grade. So the advances have been great. But I think the room in the future, if we could advance and expedite the reimbursement process, that would be huge.
So with more data, with better AI models, we can expedite the overall insurance process, and that can create a huge impact. Customer awareness, which is already high, it could also be improved in the future. Thank you. Dr. Lipsey, from your perspective, and then Dr. Mundy, you can probably go next to talk about those innovations that will impact in the next 3 to 5 years.
Well, I think patient awareness is a big help in today's world. I mean, you can't look at any kind of online or print media, TV or anything without hearing about sleep health. I mean, it is one of the hot topics in today's world. But if we talk about how we can help patients, I mean, I'm a big 1, 2, 3, try to be simple guy. You know, it's not just me saying screen your patients. The American Dental Association says every dentist should screen their patients for sleep-related breathing problems. And I'm a strong believer in that. And I think that if dental teams educate themselves so they can talk to their patients in a more understandable way, and they do this routinely for every patient, not just when somebody is tired and yawns or falls asleep in their dental chair, that we can make this an integral part of the dental practice. So I say, 1, let's screen our patients. Let's 2, have a predictably easy and successful way to get our at-risk patients tested. That's what we're talking about here, using the ring to be able to say to the patient, yeah, you could take this home tonight and let's get some more data. I think we need it, and then let's talk about it. And 3, to present this in a way that's easiest for the patient, not just to understand the treatment, but to accept the treatment because we want to be financially and insurance helpful. That has become easier, you know, as the years have, you know, come to today's world. Medical insurance is more welcoming to pay for oral appliance therapy when we have a positive diagnosis of sleep apnea. We have to learn how to present that, how to explain that to patients. And we help offices on an outsourced basis to navigate the medical insurance process so that it isn't a hurdle. And if we put all those things together, then everybody wins. To me, that is the best innovation, that we can combine technology and systems to make this work. And I think to offer patients a solution to what truly is a life-threatening and life-shortening problem.
Right. So you go one step beyond customer awareness. It is also, or patient awareness. It is also the education for dentists to make sure that they are diagnosing each and every patient that is coming their way. Fantastic. Dr. Mundy, what is your opinion on this question?
There's so many places I could jump in here. I mean, the guys did a great job. And I just say, you know, I think when you make sleep apnea truly a part of your practice, you may not get a patient to sign up or do a test right away, but you create an awareness and things are going on in their lives. And when the time's right for them, all of a sudden they'll be back asking you about it. And you forgot you even talked to them about it. Okay. And then going into the implementation, that's one of the really great things with the ring that I found is we've tried some other rings, some other form factors. The current Belun form factor is just outstanding. It's far fewer retests or bad results from the tests. So my team is much more likely to reach for that one when we have somebody who needs a test. And then to kind of move off of this for the future, knowledge is power, but we have to use that knowledge. And I just salute Belun again. You guys are always coming up with with new things, and you're always just ahead of the curve, which is where you should be. Okay, and so I'm looking forward to some, like Lydia was saying, some reports that might be focused a little bit more on specific phenotypes, endotypes, or problems like cardiac patients. I think when the MDs finally realize they've got a source here, they're sending patients to us to treat for sleep apnea, but they're getting back data, multi-night testing on whatever parameter it is they're interested in. What cardiologist is not going to want to look at parasympathetic sympathetic nervous system balance over over a period of time. What pulmonologist is not going to want a deeper dive into oxygen issues? So if we can get those, and if we as dental clinicians can integrate that in our reports and in our conversations with people, everybody's going to win. The referring docs, us, and especially the patient.
Interesting.
I'd like to throw in one more thought
Please.
that we talked about ease of use, and this is directly related to the Belun ring, and I don't think it's been mentioned. And we all have patients of not, and sometimes we say, well, it's older people that aren't so technology friendly. I think we have patients of many ages that aren't technology friendly.
Right.
That we don't have to have a patient deal with an app on their phone, I think is an often overlooked advantage of this system. We can't assume that everybody's great on their phones. Yes, younger people are doing everything on their phones today, but not everybody falls in the category of being app friendly, that we don't need to be using an app on the phone, expecting our patients to be using an app on the phone, that they can use this ring and get tested without having to worry about pairing with an app, I think is a major plus for ease of use here, and that we should keep that in mind. I keep that in mind when I'm talking to dental teams, about an easy way to get their at-risk patients tested.
Well, Marty, I think it even goes beyond that, because that is huge. I agree with you there. But then also I have patients that may drive in an hour to come to the office. And if they can have an app and get us the information, that opens up the possibility of doing some telemed. So the ring, the flexibility and implementation is outstanding.
We've done something along those lines.
Yep.
When we get the results back to the patient, I have patients for 200, 300, 400 miles away, and to make that drive for a 15-minute appointment is kind of ludicrous. So I have mail it in to me, and it costs them $7.99, which is a lot less than the gas they'd spend. They mail it to me. I email it the results, download the results, email them back, and we'll sit down on the phone and go over it. This is this test, these are these numbers that we've already highlighted, and this is the combination of the titration where you belong. Congratulations, you've graduated. You saved yourself driving back and forth to the office. Right. So that's been very popular with our patients.
So you have essentially created a side telehealth arm with Belun technology on your own, which is fantastic. Dr. Tozzer, appreciate that. Appreciate saving all the gas and all the time that you are saving for the patients. But let me ask one more thing to Dr. Tozzer, because you have been working with School of Dentistry at USC. What is the advice that you would like to give to new dentists to incorporate or expand sleep apnea services in their existing services? What is the first smartest step that they should take while expanding their services, Dr. Tozzer?
Yeah, well, I would encourage them to learn as much as they can and start implementing sleep apnea early instead of waiting. It's not that complicated. The technology has made it much simpler to help these patients. Also, I could point out that, the ADA has recommended for 8 years that we screen for sleep apnea. In California, it's actually required. It's part of the Dental Practice Act. We're supposed to be doing this. And just as, we're supposed to be screening for oral cancer, which we'll rarely find, we need to be screening also for sleep apnea, which is a quarter of the adult population. The other interesting stat is that the Wisconsin cohort suggests that treating sleep apnea successfully will extend their lifespan 5 to 8 years. There's nothing else we do in dentistry that comes close to that.
Fantastic. Thanks a lot, Dr. Tozzer. Your thoughts on the last question. Any last comment, final advice or takeaway on the sleep apnea from any panelist? Lydia, I know that you have been quiet for quite some time. Any thoughts from your side?
No, I would just like to take this opportunity to thank all dentists who walked along the journey together with Belun. With all the features that we developed, I think this is very important for all innovative technology, is that to understand the real needs of your end users and get in there all their comments and suggestions seriously. And that's as just what Dr. Modi has mentioned. Indeed, we are gradually keep improving is because we get a lot of good suggestions that we never think of as a technology provider from the real users, right? We get feedbacks from their from dentists, from their assistant, from their nurse, from their office, and this all help us to keep improving the system and also to fit in the workflow of dental sleep medicine, and which we think which is very important. And all the features that they have just mentioned is indeed from their suggestion and recommendation, and that's how we can do a better job.
Fantastic. Thanks a lot, Lydia. Any final comment or thoughts from Dr. Lipsey or Dr. Mundy?
I'll give you a final invitation to anyone listening. I'm really passionate about helping offices to implement and help more patients in that process using this Belun Rig technology. We have great ideas on easy ways to make this work for the dental team so that you don't hit brick walls. My website is in my signature, and through Belun or through contacting me on our website, I would love to help show you that you can make this a growing and helpful area of your practice, and reach out to me. I would love to speak with you as a follow-up to this.
Thank you. Thanks a lot, Dr. Lipsey. Appreciate that invitation. Thanks a lot for that. Dr. Mundy and Dr. Tozzer, please.
Final thoughts is, I think this is an area of dentistry that we really should be addressing. For patient care, patient longevity, and it is daunting. It does sound scary, but the technology and the support with the medical billing, outsourcing that makes it a lot easier to implement. So my advice is, don't be the 95% that get frustrated and give up. Continue to pursue it. Embrace the technology and embrace the thought that you're going to help take care of your patients.
Fantastic. Thanks a lot, Dr. Tozzer.
There are a lot of benefits to be gained for everybody involved in this. Certainly your patients are going to be much better off for, if every dental office did actually screen, it would be monumental, the difference that it made. And so keep on keeping on. There's a lot of, over the years, I've tried to implement different things into the practice, and sometimes they didn't really line up with what I really liked, or the flow that was required to make that work was just not compatible with the general practice. I think you're going to have a little bit of that with doing sleep apnea, but there's plenty of room for sleep apnea treatment in any general practice, and you can do it at any level. You can make it your own thing. You can make it an occasional thing, but get into it and do it, and take advantage of guys like, take advantage of Marty in a good sense. Get help in the areas where you need help. Find out about the great technology like Belun out there, and use that technology. And if you try something and you're not getting good customer support, or it's not working for your patients, go on to the next thing. It's okay. You've got a whole career ahead of you to work this thing out, and it's worth putting in the time and the effort for. I find it very rewarding. I mean, you get a couple patients where it changes their lives. That's pretty rewarding. And that's out there.
Fantastic. Yeah. Thanks a lot, all the panelists. Really appreciate your time and your insights today. A few takeaways that I had from the session are diagnostic barriers are being overcome by wearables and AI. And as Lydia mentioned, garbage in, garbage out. So they are making sure that they have the right kind of data and they are able to improve the model of Belun technology with each and every new data set that they are capturing, and they are making the efficiency, the efficacy, the accuracy of their solution higher as time progresses. I think we heard a lot about user friendliness. We heard about a lot about user awareness, and also about a good training education for the fellow dentist, so that they understand how they can have a good business out of dental care as well. I think we heard a lot about how insurance companies and the overall operational ecosystem need to work well in a well collaborated manner with these new kind of innovations to make these make the adoption easier and efficient for these kind of innovative technologies. Screening every patient is extremely important. It's every dentist's responsibility to make sure that they are, screening the patient as early as possible. The future of such technologies lie in personalized and data-driven care. These are some of my key takeaways, but I'm sure once we post this on different channels, we will have more takeaways in the comment section. Again, the future of sleep apnea care is collaborative, technology-enabled, and dentist-driven. We encourage all the audience, all the listeners to explore these tools, connect with the panelists, and take the next step in transforming care of their patients. Thanks all the panelists. Really appreciate your time. As I mentioned earlier, we will be jumping into another session right after this. So I would request you to stay if you are available, or probably move on to your daily work. But really appreciate your time, and I'm sure that we will reconnect soon to explore more synergies and find areas to collaborate. Thanks a lot. Thank you very much.